listeners, welcome to Views on Health. Back with me on the program is Dr. Bimantha Perera, consultant ENT surgeon, Teaching Hospital, Anuradhapura. A warm welcome to our studios once again, Doctor.
Thank you.
And for the information of our listeners, we had Dr. Bimantha Perera speak on obstructive sleep apnea the last time around. And tonight, as part of his specialty, we're going to focus on loss of hearing. Over to you, Doctor, to introduce the topic.
Thank you very much. It was a pleasure to come back. So today I just thought on focusing on hearing loss. Why hearing loss? Believe me, that's the second most commonest disability we have in Sri Lanka at the moment. This was the regard depending on the census for population and housing done some time ago, though. But believe me, it's the second most prevalent disorder. So basically, I'd like to talk on hearing loss for adults and children because the approach is totally different. Let's talk about you and I. Basically, I'm sure you would have experienced at any given point at least a brief time of hearing loss. So most of us have, and the commonest cause is wax. Okay, so just before coming to hearing loss, let's just for our listeners just tell the ear. We as doctors, we divide the ear into three parts. One is the external ear, which obviously you can see, which is known as the pinna, and the ear canal, separated by the eardrum, or what we call as the tympanic membrane. That separates the outer ear from the middle ear. Now, the middle ear has the smallest bones in our body, three little bones, which conduct this sound, which is vibrated through your eardrum, to the inner ear, which is the third part. Now, that's the fascinating place where this mechanical conduction is converted into an electrical impulse, and that's taken right into the brain through your nerves. Now, any place, any one of these 3 points could be a cause for hearing loss, and some may be correctable, some may unfortunately be not, and some may be age-related, some are not. So let's talk of the most common things, and I think you would be more interested in wax. I'm sure all of us have plenty of wax in our ears at the moment.
Doctor, how does one know one has wax? That's just a question. Yeah. Another thing is that you said that at some point in time, everybody would have felt some sort of loss of hearing. Now, would you say that people say, and I can relate it to myself as well, suddenly you get like a sort of a buzz in the ear or something which passes off.
Yes.
But then you find you can't hear.
Yes.
Then the other thing is that maybe totally unrelated, when you get on an aircraft, you have your ears blocked.
Exactly.
So could you please
So they are
explain?
totally two different entities, but maybe interrelated as well. So that's why I thought wax is a very important subject. That the wax is an absolutely normal thing we all should have in our bodies. That's not something you and I should try and remove. So that is possibly my take-home message as well, which I'm telling now. Do not remove your wax. Why? It has protective properties. It protects your skin and the external ear from all microorganisms. It has a pH value of 6.5, so it basically acts as a deterrent. And obviously when you have wax, even insects don't come in. It's a natural insect repellent. So the wax is usually formed within the ear and it naturally comes out. So when we have a shower, it'll just fall off and it'll just get dissolved and go away. We really don't need to remove it. Unfortunately, in some people, this mechanism doesn't work and it gets impacted inside. That's in a subset of people. But in majority of our population, what happens is we impact it. How do we do that? We use cotton buds, the this little spoons they have, all sorts of things. And we disrupt this natural process of its expulsion and we push it further in. And that's what causes most of the problems. And we get quite a lot of patients with wax impaction saying, oh, we suddenly cannot hear and there's a buzzing noise in our ear. Sometimes it can cause pain, not all the time. That's why some people may not notice it. But if they do get some pain, they'll seek medical attention and then we see it's wax and we remove it.
Doctor, what is interesting is you saying that when you have a shower, that it gets washed off.
Yes.
One doesn't even notice it.
No, you won't. That's the beauty of it. That's how our body is made.
But it does get washed off.
It gets washed off.
Provided you wash your ear.
No, you don't need to wash your ear. And in fact, we do tell people who have problems not to let water go into the ear to prevent problems. I'll come to that later. But the natural process is it just gets washed off. It comes out or it falls off. Or when you have a shower, it'll just wash off.
People do talk of having an itch.
So that's the most common complaint we get, that our ears are itching. One of the causes for itching is excessive wax, or it could be an insect, or it could be some ear discharge. But the most commonest cause of itching is your actual physical act of itching, which I tell the patients it's as addictive as taking drugs. So that deters them a little.
Because people tend to,
Yes.
put something into their ear,
ears.
like you said a while ago.
Yes, and that actually increases the itching sensation.
Thank you, doctor.
And coming to problems in the external canal again, one may get infections of the external canal, which is very painful. Again, the major cause is usage of cotton buds, and you can get something known as swimmer's ear, which is quite common in swimmers when there's excessive water getting stuck in the ear and macerating the skin over there. And quite often we do get fungal infections of the ear, which is excruciatingly painful. But just a simple clearance and some antifungal drops or cream solves the problem. Now, coming to the middle ear problems, now that's where we have a lot of variation in adults and children, all having a very similar pathology though. Basically, if there is some fluid or anything in the middle ear that obstructs the vibration of your eardrum, that would cause an impairment of hearing. Or if there is a loss of continuity of your little chain of ossicles or bones, that could cause a hearing loss. Or if there is a damage to your eardrum, maybe permanent, maybe temporary, that will also cause a problem in hearing. Or sometimes the fixation of your little bones, which we call as otosclerosis, this also is another cause. Then the third part, that's the inner ear. Unfortunately, the inner ear problems are not very amenable to treatment. And in old age, as you know, we all have some sort of hearing loss. So after the age of 30, it's downhill, I'm sorry to say. 30 to 40 years, it would be downhill all the way.
As young as 30?
Unfortunately, yes. But it varies from person to person, because I'm just telling an average. There may be some people having perfectly normal hearing even at the age of 50 to 70. But you would notice that they start their hearing loss with very high frequencies. So probably they won't even notice till they're quite old. And this is what's called presbyacusis. For some, unfortunately, it starts quite young, early, and it'll be noticeable by the age of 40 to 50. But in a majority of our people, it's almost like this. Probably more than 2/3 of people over the age of 80 would have it. So that's a pretty common thing, isn't it?
But amongst the younger age group,
It's
what are
less.
the signs and symptoms?
So hearing loss usually comes, let me talk about the adults, the young adults. So they are very good at picking it up, especially young adults in their 20s, 30s. They have very acute hearing, and even the slightest loss of hearing is quickly picked up. They usually come telling that they probably have a ringing sensation in their ear or fullness in the ear, or they probably cannot understand all the words that are being told. These are the common things. And what do we do then? We generally ask for a hearing test. And in the hearing test, we can actually, it's a subjective test. The patient sits down, we put earphones and give them various frequencies and tones and see how they can hear. And based on their answering capacity, that matters a lot here, we can tell whether you have a mild hearing loss or a severe hearing loss, or what's the extent, whether there's a bone destruction or whether it's actually a problem within the inner ear. Now, coming back to that inner ear problem, some people have this loss of hearing over a period of time, but rarely this can come as a sudden onset hearing loss. So this is a message I would like to give to our viewers, that there is no real age limit for this. It can happen to you and me even today, even tomorrow. You really don't know when. The etiology, or why does this happen, it's not really clear. It could be a viral infection, it could be just a common cold, it could be a mini stroke which was not detected. So it's a wide array, but they just come and tell that I suddenly lost my hearing. Now the important thing is, in most of these patients, if they come within the first 24 to 48 hours, we may be able to offer them some treatment. We usually give a high dose of steroids or an intratympanic, that means an injection into the ear, a steroid injection into the ear, because it's your hearing, you're going to lose your hearing, so we can't really take any chances. So we start them with all the possible medications, and a subset of them do recover, especially if it's following an infection or inflammation, they will recover, but a subset may not. Unfortunately, if this gets delayed, so by 2 weeks your chances of recovery are going to be low, and after 1 month it's almost nil. So it's very important that if you do notice a hearing loss, especially a sudden onset hearing loss, please seek attention early rather than late. That's a very, very, very important message.
But that's applicable to any medical condition.
Yes.
And this should be no exception.
This should be no exception. Unfortunately, if you come early, we might, I'm not saying we will, but we might be able to save your hearing.
So it's quite dicey.
Yeah, it's quite dicey. Why is hearing so important? Because unfortunately, we don't give too much attention to our ears as much as eyes. We wear 2 spectacles, but we don't mind having 1 ear. I don't think that's the correct way we should go forward, because we need both ears for hearing and for directionality. Simple. If you're crossing the road and you hear a bus coming, if you see a bus coming, that's fine. But if you don't see, and if your right ear is working and your left ear isn't, you'll only hear it from the right. So if the bus is actually coming from the left, you probably won't know. So that's how important it is.
But then what about the hearing aid?
Yes. So that's the treatment part of it. So if you have a hearing problem, and if you have especially a problem in your inner ear, the treatment is hearing aids. But if you have very profound hearing, that means there's absolutely no hearing in both ears, we also have the option of cochlear implant. I'll come to that later. We'll talk about cochlear implants with the children's hearing loss, actually. But hearing aids are very important. Again, using hearing aids to both ears, that's important. But obviously some people have only hearing loss in 1 ear, so then they just need only hearing aids in 1 ear. The technology is greatly improved recently, so some people may have complete loss of hearing in 1 ear, and then conventional hearing aids may not help. So we do have different types of hearing aids for them. Now, is it okay if I talk about children? That's another interesting area, because in Sri Lanka we have started a national program for prevention of hearing impairment and deafness in 2012. I think this is a program from WHO. So we have this program from 2012 to 2030. And also we have a neonatal screening program as well, which we've started in Sri Lanka. It's a universal screening. So why are we giving this emphasis on children's hearing, especially newborns? The reason being, if you don't hear, you will not be able to speak. So you will be deaf and dumb if you don't pick it up. So what the government is doing is trying to implement this program and identify or screen all babies that are born. It's still not been done. We have started it in the teaching hospitals. What we do is we screen all the babies as they're born before they're discharged. And then if they fail that, we subject them to further testing. And if they fail all the testing, then we have to decide, okay, this patient may need an early intervention with a cochlear implant. And it's fascinating. This little gadget which you surgically implant into a child's head gives them hearing. And we do this by the age of between 1 to 2. What's important is we have to start this treatment by the age of 2 to 2.5 years. Otherwise, they don't develop the ability to speak. So that's the reason why we don't do it for the more older people, older children who can't speak, because there's really no point. And believe me, this is a very, very expensive affair. And thankfully, in Sri Lanka, we do it absolutely free of charge in the government hospitals.
Tremendous. Doctor, there is a pediatrician when a baby is born, and he or she is expected to check the baby out. Now, wouldn't that, at that stage, a pediatrician check this particular aspect of the child's well-being, the hearing, or is this a separate exercise altogether?
That's a very good question. In fact, unfortunately, it's not easy for a pediatrician to catch hearing loss at an early age. The reason is the newborns will not respond to noise immediately. So we have objective tests which could possibly indicate that this patient has a problem. And then with time we do further investigations only for those patients. So if we screen all of them at the beginning, we just get only a few patients to deal with later.
Yeah, and obviously you do detect them early. Yes. And you know what to do.
Yes. And apart from this, there is another subset. Young children who have loss of hearing. Now, when young children have loss of hearing, they have delayed speech. Or again, they may not be very attentive, or they can be hyperactive. And quite often, mothers are very good at detecting this rather than doctors, because they deal with the parents, with the children more often. And quite often, the nursery teachers recommend these children to us. Till that, see, they've noticed something wrong in the child's behavior, and then we do a few tests to determine whether they have a problem in that middle ear, or whether they actually have hearing loss as well. Now, quite often, you'll be surprised that children do have a lot of mucus or a fluid behind their middle ear. This can be treated, but you really need to identify this problem first. And we can obviously give them some medication and see whether it works. But rarely, to a subset, we may have to do a surgery known as a grommet insertion. We basically make a hole by ourselves in the eardrum, take out all the fluid, and put a little piece of plastic in to aerate the eardrum very well. Now, there is also another subset, which is the chronic otitis media, which is basically an ear infection, which is quite common again in children. So we recommend that these mothers do come to us and get adequate medical attention early again. When coming to chronic otitis media, there are two entities. One is the common gungy middle ear discharge that we do get, which can be quite copious, and mothers and don't tolerate that well because they are quite worried. But there is another subset which is known as a cholesteatoma, which is much more dangerous actually, which gives a foul smelling discharge but very scanty. So the problem is, a child with a discharging ear we can probably treat with antibiotics, but if that child has a cholesteatoma, which is basically the tympanic membrane or eardrum being kind of sucked in and forming more gunge inside the ear, that can be dangerous because it can destroy the bone around and cause problems to the brain, problems to the facial nerve, the nerve that gives all your muscles the power. And this is only amenable to surgery, unfortunately. But patients do very well after surgery.
But doctor, in that condition, won't it be uncomfortable for the child? I mean, they can't even express themselves.
They can't even express themselves. That's the biggest problem. But we can see. We sometimes have to put them to sleep under anesthesia and examine the ear very properly. But if we do find a cholesteatoma, we do surgery quite early.
Is that a common condition?
Not a very common condition, but it is, yes. I would say it's not rare. It's an uncommon condition.
What's the age?
Okay. Again, age is not a factor here, but you do get the children having congenital cholesteatomas. That's what we technical term, where we think that some of them may have this since birth. But you can also get this in adults. And you can even have them in older patients as well. So it's a disease, you can have it in a wide spectrum, but unfortunately the treatment is only surgery.
And it's happening?
Yes. Even in our hospital in Anuradhapura, we do at least one surgery a week. So it is...
So that's a lot.
Yeah. But I suppose it's a wide drainage area, so we do see quite a high number.
Doctor, once again, time is catching up with us. We need to sort of, I think our listeners would be interested to know that this treatment that is given for loss of hearing, so once you treat them, are they done with it? Like, are they okay? Do they need to come back? Do they need to have any sort of, follow-up?
Yes.
Do they need to, maybe change of medication,
yes.
change of various, maybe if it's a hearing aid, you need to change that.
So if it is a problem of ear discharge, they needed to be treated with antibiotics or the appropriate surgeries, or correct their eardrums with a surgery. But if it is a problem of basically hearing loss due to the nerve damage, now they would obviously need hearing aids. Now, if they are given prescribed hearing aids, they would need to maintain this. They need batteries, they need frequent follow-ups with the audiologist whom they would need to program, especially the older generation, where they might find this a little cumbersome to handle. So they may need frequent visits, probably once every 6 months to once a year, depending on the person. Yes, long-term follow-up is needed. But otherwise, if it's a simple ear discharge, especially in children, most of them do recover after medication, and that may be it.
But with a young day, I think they are more able to, the system will be able to handle it.
Withstand, yes.
So it's as against an older person.
Yes.
So, I asked about hearing aid because, see, if you take something as simple as spectacles, we need to get eyes checked, and they may change the lens.
Yes.
As in how they are required. So similarly, with the hearing aid also need to be changed. Very
indeed, because as you know, when you grow old, you would need to change your spectacles. Similarly, when you grow old, your hearing comes further down. So you need to readjust your hearing aids to your requirement. All hearing aids are not the same. So they need to be custom adjusted to each person's requirement. And this entails, especially for the students, probably young university going students, some people require very good hearing, so we have to constantly adjust them. Some can be book company directors, where they need to really focus on basically meetings, but there can be the old gentleman who is seated outside, who doesn't need too much of attention. So it's very custom.
One final question: earphones. Now, they are so widely used for your mobile phone, the computer.
Yes.
Maybe in the past it just to be listen to some music, but now it's used so much.
So much.
What's the impact of that on one's ear?
I would kindly request you all to go and see the packaging of an earphone, which clearly states that there is a possibility of damage to your ears if you use more than 20 minutes. I really think none of us have read that. It was shown to me by a patient, to be honest, and I was quite surprised myself. Yes, that is a problem, especially the earphones that go right into your ear. They are more damaging than the ones that are just put above, the big ones that are put around your ears. Obviously, loud music can cause a lot of problem, and loud noises do cause hearing loss in the long run.
There's so much of online stuff taking place.
Yes.
It's I think rather frightening to see people across the board, children, young adults, the older generation, with the earphone plugged in.
Very true. But also, ironically, we've got patients who come early now telling that, we've noticed a slight hearing loss because we are using the earphones and we can't hear from the right ear. So
they realize.
They realize it as well. But yes.
But it can be addressed. If they do come, it can be addressed.
It can be addressed. Yes, it can be addressed. We can see what's the problem. And overall, we do recommend not to use earphones for a long period. Soft music or soft talking is fine, but not loud conversations or loud music.
And the duration, you said, is 20 minutes.
That's what the packaging says.
What would you recommend as a professional?
So I would definitely recommend the same. But I would also say that it's best not to use the ones especially right deep in your ear for a long time.
Thank you, Doctor. And anything else you'd like to add to this very interesting discussion on loss of hearing?
Yes, I think the main thing is, if you do notice hearing, please get yourself evaluated by a professional and consider the treatments available. Don't suffer with hearing loss, because that is basically not acceptable at this time of age and time, basically. And if you do get a sudden onset hearing loss, please come immediately to the closest ENT facility, and they are easily able to help you out with this.
Thank you, Doctor. On that note of advice, we end this interesting discussion on loss of hearing. We place on record our grateful thanks to Dr. Bimantha Perera, Consultant ENT Surgeon, Teaching Hospital, Anuradhapura. Thank you so much for sparing a very valuable time in the midst of your busy schedule and speaking to us on this topic. Thank you, Doctor.
Thank you very much.
Thank you also to Malintha Deshapre for technical assistance. This is Fatima Razi Khad saying good night, and hoping to catch you next Monday same time on Views on Health.